Welcome to Moments with Marianne. This is your host, Marianne Pastana, and we're here today with special guests, Lucille Accetta and Edwin McGee, and they're here to share with us CVS Health meeting growing demands for convenient, personalized care. So let's think about this for a moment. Community pharmacies do so much more today than filling prescriptions. They provide accessible and affordable healthcare, including vaccinations, clinical services, and medication management support. As more people depend on them for local, personalized care, a new report from CVS Health sheds some light on what's ahead. Joining us to share more about what patients and pharmacists can look forward to are Lucille Accetta, Chief Pharmacy Officer, and Pharmacy Manager Edwin McGee from CVS Health. So welcome to the show.
Thank you.
Well, what an honor it is to have the both of you here. And Lucille, why don't we start with you? Can you first please give us a little background on this latest report and what some of the key findings are?
Yes, Marianne. The survey really showed that there were three key messages. One is patients truly trust their pharmacist. They also want to have face-to-face interactions with their pharmacist over digital pharmacy. And they also really prefer and want to have expanded care and services from their local community pharmacy. And as a pharmacist, I can tell you that these are truly attributes that we see each and every day from our patients.
Well, that's so good to know. And I know, Edwin, you're just like on the front lines of patient care. What opportunities are you seeing right now in the pharmacy industry?
Well, I'm seeing a lot of growth in pharmacy, and the role of the pharmacist is changing and diversifying, which is so great because it gives us great opportunities to be able to continue to grow and change as the patient demand changes, and especially the times that we're living in. From the survey, one of the things that Lucille pointed out was I thought was important was that 80% prefer inpatient care. So what does that mean? Like that means that our patients, they rely on us, they trust us, they need us. Like we have to be there, we have to show up for them, and that's something that we're very passionate about is being able to be there for our patients and build those relationships. I have a patient that I just think about all the time, and she always is looking for, for me to be at the pharmacy when I'm there. She knows what kind of car I drive. She's like, well, I didn't see your car, so I didn't stop by. I didn't want to pop in, so I'll be by the next time that you're there. So just little things like that, like patients, like they pay attention to the small things.
Well, that trust is so important in developing those relationships, which you have done very well. It sounds like people are really relying on you to get that expert opinion. So, Edwin, how would you say that pharmacies can balance the use of technology while providing the care patients expect?
It's so exciting. I love the use of technology right now, and especially like the times that where we're at, and technology is improving that work-life balance for us as pharmacists. One of my greatest things that we have implemented is our phone calls system. So now we switched over to a voicemail system, which is exciting. So once you kind of get used to it, it's great. So patients can leave a voicemail and we return a phone call. So how does that change for the workflow for the pharmacist? Well, now you don't hear that one pharmacy call, two pharmacy call, five pharmacy calls. So then now we're trying to figure out, do I get the phone call or do I help the patient that just walked up that needs a consultation? Or can I spend an extra minute or two to be able to make a recommendation? So it provides us that balance so we can still be able to provide that expert care that we need to provide. And then once I finish with the patient in front of me, then I can be able to go ahead and give that phone call back to the patient that called in that needs my help as well.
And Marianne, I can share another technology that we have that's really impressive, and that's what we call dynamic workflow sharing. And if you're the pharmacist a couple of miles away and I'm in a pharmacy and I'm running behind, you can actually jump in and help with some of my tasks, which would make it a really supportive win-win situation for both of us in getting through our work.
Well, that sounds so fascinating. So, how can a pharmacist at a different location help you?
Well, there's the ability to tap into our systems, all on a dynamic workload system, and it really does work very well to help balance out the work we're all doing.
That is so fascinating. How great is that you have this network of other pharmacists that can help you?
Exactly.
It's been a game changer.
My goodness. Well, I understand that this report found that 75% of retail pharmacy professionals aspire to provide more care for their patients, and 70% of patients believe that their local pharmacist should be able to provide health care services when primary care is unavailable. How is CVS responding to this finding?
Well, Marianne, typically and traditionally, pharmacists were always thought of as just dispensing medications, but we can do so much more. Obviously, with immunization, there's over 15 vaccines that we can provide. We can actually test for certain illnesses, and we can prescribe for certain therapies. So the practice is expanding, and we are advocating on behalf of our pharmacy team to work at the top of their license and also in public policy to continue to create the expansion of the role of the pharmacist. And as we mentioned, that's what patients are looking for in that expanded care and service.
What would you say are some of the main takeaways from the 2025 RX report?
I would say, again, it's trusting the pharmacist is key, as Edwin mentioned earlier, and that also that in-person care is really important, and that these services that we're providing are key to the community and public health.
Those are some very big takeaways. And it's interesting, often you hear about people who are thinking about a career in pharmacy. What would each of you say to someone who's considering that?
That's a great question. The greatest thing that we can be able to provide back to help uplift our profession is mentorship. I love mentorship. Being able to make an impact on a aspiring life is so amazing and so rewarding. So we have so many different avenues and so many things that we offer to be able to provide and be able to help one on that journey.
And Marianne, I would say it's a truly rewarding profession. Helping patients every single day is really a component of being a pillar in the community. And we offer our technicians, we know that from the survey, 40% of technicians want to become pharmacists. So we encourage situations like offering tuition assistance, scholarships, and even collaborating with many colleges of pharmacy throughout the country and inspiring students to become community pharmacists.
Well, that is so exciting to have that support to grow because, once you become a pharmacy technician, I could see where there's this desire then to become a pharmacist.
Absolutely, and we see that every day.
My goodness. Where can our audience go for more information about this report?
They could go to cvshealth.com/RX-report.
Lucille and Edwin, thank you so much for taking the time to be on the show with us here today.
Thanks so much. It's been a pleasure.
Thank you, Marianne. Great talking to you.
Well, thank you both so much. It's been such an honor to spend this time together and to talk about the CVS Health, the RX Report, Community Pharmacy Reimagined. To see the full report, please visit cvshealth.com/RX-report. Well, we're at the end of our time today. I'd like to thank everyone for tuning in. You've been listening to Moments with Marianne, where we make every moment count.
In a single moment, your life can change. Moments with Marianne is a transformative hour that covers an endless array of topics with the best of the best. Her guests are leaders in their fields, ranging from inspirational authors, top industry leaders, and business and spiritual entrepreneurs. Each guest is gifted and a true visionary, a recognized leader in her own work, and while teaching others to develop, refocus, and grow, Marianne will bring the best guest and sometimes a special surprise. Don't miss this. You never know just which moment will change your life forever. Make sure to tune in and visit momentswithmarianne.com for more information.